most of our children who are treated for cancer receive care at a children's hospital. And most of the children's hospital allow the healthcare providers to care for the patients only up to the age of 21 or at the most up to the age of 25. So our childhood cancer survivors age out of the system. And what happens then is that they need to be taken care of in either of the following scenarios. So the model of care could be that they are taken care of by an adult oncologist or by a primary care practitioner or by health specialists such as an endocrinologist or a cardiologist or a pulmonologist, depending on what complications these patients might develop. So there is no one really, once they age out of their pediatric situation, no one who assumes the comprehensive and complete care in the preventative, what we call the well person kind of a fashion for our patients. So nobody to anticipate the complications, nobody to screen them for those complications, nobody to educate them. So how can we overcome these challenges? The way we can do this and the way we are trying to do this is to, first of all, make our survivors aware of the long-term complications that they have, educate them, make sure that they carry a record of all the treatments that they got and the complications that they could be at risk for. And so when they go to see a primary care provider or a clinician, such as a specialist, they present them with this treatment summary and the care plan that they have. And once they've done this, the hope is that they will receive the appropriate care that they need. Another way to deal with it is to develop what is called risk stratified care, so that those who are at the highest risk of these complications are kept within the system, and those who are not at such high risk are allowed to be seen by the primary care providers and other people outside of the community.
For clinicians, when a pediatric cancer survivor becomes their patient, what are the most important things for them to consider?
Right. So for them, if it's a clinician who has never seen a patient or that patient before, what they need to know is what was the cancer diagnosis? What age was the patient diagnosed at? What year was the diagnosis? Because treatments differ at different times. The ideal situation is for the clinician to have a summary of all the treatments that the patient received, as well as what we call the roadmap or care plan of all the complications that they're at risk for, as well as some kind of all the recommendations of the screenings that they need to be doing for those patients, such as echocardiograms or mammograms, depending on the treatments that they received.
And let's talk about, for survivors, what can they do to get the most benefit from their post-treatment care?
Right. So they should, the patients themselves, the survivors, as well as their family members, whether they be their parents or any other significant other who is going to assume the care of the patient, in addition to partner with them in taking care of the patient, need to be aware of the treatments that the patient received, and then what they're at risk for in terms of long-term complications, and then also a care plan of what screenings they need to have undergone every year, they need to undergo every year in order to make sure that those complications are detected at an early stage.